Hello and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining us today. Before we get started, please hit that subscribe button. It helps us out a lot, and you'll stay up to date on all our upcoming shows. You can also check out a lot of additional information on our website, Instagram, and Facebook, and all those links are below. So today we're going to learn about an anxiety disorder called Obsessive Compulsive Disorder, or OCD, and we'll be covering what it is, possible causes, symptoms, and therapies and modalities that can help. Now, anxiety disorders are the most common mental illness in the US, affecting 40 million adults. And they are highly treatable, yet only about 1/3 of those suffering receive treatment. Now, OCD, which is a specific type of anxiety disorder, affects about 1 in 40 adults in the US. And it was once ranked in the top 10 most disabling illnesses by lost income and decreased quality of life. So it can be quite debilitating. Now, the average onset of OCD is 19 years old, and approximately 1/3 of affected adults first experience symptoms in childhood. So my guest today is Carly Samach. She is a licensed therapist specializing in OCD and anxiety, and has been a practicing clinician in the mental health field for the last 10 years. Now, in her work, she combines both clinical and holistic values, incorporating yoga, art, and other therapeutic modalities. So thank you so much, Carly, for joining me today.
Thank you. Thank you so much for having me.
I'm really looking forward to learning more about this. Now, you've been a licensed therapist for 10 years. What inspired you to become a therapist, and what was the catalyst to specialize in OCD specifically?
Yeah. So becoming a therapist for me was a bit of a journey. Like I think it is for most, finding your thing is for most people. I always like to say that I fought it at first. I had heard growing up, oh, you're such a good listener. You're so good with people. I think you'd be great at this. And I was like, no, I'm a mess. I can't be a therapist. Like I can't tell people what to do with their lives. Came to find out as I took psych courses, mostly out of necessity. Like I think for college, you have to take a certain number of courses and different types, and ended up taking a few psych courses. Realized that's really not what therapy is about. Therapy is about being there with yourself and talking about the hard stuff and learning and building. And I learned that both through school and then also going to therapy myself at like that young adult sort of age. So that was what kind of piqued my curiosity. But as I sort of followed my heart with that, what really sort of captivated me was this sense of being able to witness another person feel, hear, and learn their own story, maybe in a different light. They come in and they have this very self-critical view, and they come out of therapy with this much more world view of themselves. It was just too much magic not to fall in love with. So that was really what brought me to therapy. OCD was something that I became increasingly interested in my clinical journey. It's really prevalent. 1 in 40 people have it. So in my clinical work, I was seeing more and more people with obsessive and compulsive type thinking styles. However, the typical, what we think of as OCD, cleanliness, orderliness, wasn't fitting the bill for these individuals. So I did some more digging. I found OCD, realized they were a program that cared about advocacy and about teaching what OCD was really about. And that was kind of all she wrote. I dived in after that.
Beautiful. And it's interesting you say that. Why do you think OCD is so misdiagnosed and misunderstood?
Ooh, that's a great question. I think primarily it's because it's become a stereotype to some degree. And, I've talked in the past about how it's no fault of people, when they don't understand something, they don't realize something that is being spoken about is actually a much bigger problem for so many. But that's why NOCD is so big on advocacy. We want people to understand that it isn't an adjective. It's not this stereotype of orderliness and cleanliness. And I think that stereotype has come primarily from media. You see a lot of TV shows and movies where they illustrate a person who has a very particular kind of OCD that, yes, I see in my clinical practice, but it's one of many varieties.
Right.
So part stereotype, part media.
Interesting. Yeah, I mean, I feel like in talking with friends, we hear that word kind of thrown around a lot, referring to friends who keep their homes exceptionally clean and tidy, their OCD. So there's definitely a lot more to learn. I don't know a lot about like any of the other aspects about it. So let's get into getting a good understanding of what OCD is. Can you kind of walk us through what it is, the symptoms of OCD, and how would we know if we're actually experiencing it or if our child or teen is starting to?
Yeah, great question. So the global definition of OCD is a mental health disorder in which a person is having intrusive and obsessive thinking. So intrusive, I want you to think of like it's an intruder in my mind. It's these thoughts that come in without welcome, without warning, and they get really loud and in my face. They're sort of they grab my attention. They tend to be fear provoked or worried provoked. Often they can be odd or bizarre. There's obsessional qualities. I can't get off thinking about this intrusive thought or about this trigger that's occurred. And essentially what happens is a person's brain misinterprets how important that thought is. So for anyone, any human being, we all have intrusive thoughts. We all have sticky or obsessive moments. However, someone who doesn't have OCD, their mind doesn't misinterpret it as a threat. It's annoying, it's frustrating, maybe it's anxiety provoking for a bit, but then we move on. Someone with OCD, no, it feels like a massive threat is on their hands and they have to do something about it. That's where compulsions come in. These are mental rituals trying to relieve themselves, trying to satiate that need for certainty, to get rid of that fear. It can be physical rituals. So this can look like thinking about contamination, one of the more common ones that people hear about, but it could also be really taboo type subjects such as harm, sex, gender, religion, relationships. It could also be about balance, symmetry, existentialism. I mean, themes really range widely. Most commonly, a person's obsessions correlate with something that they feel vulnerable about or they value. So for instance, someone who has a harm OCD and fears deeply about what if I could be someone that harms someone. Again, not a thought they want to have, not a thought they align with, and that's why their brain is going, this is a threat. Rather than recognizing that they have control, it's just a thought, their brain goes, this is a problem, because they care so deeply about not hurting a person. So OCD tends to go after our values. Some ways a person can recognize might be going on for them. There's a difference between having what I would refer to as obsessive and ruminative moments. We're all capable of that, OCD regardless. If it's dysfunctional, if it's getting in the functioning of your life, you're not able to enjoy the activities you used to, keep up with different kinds of tasks and responsibilities, be engaged with your space as you at baseline would. If your distress level is off the hook, this is probably a pretty good indicator that those symptoms and that functioning level together means that there's a disordered amount of OCD that's happening. And that's when treatment comes into play. Teens and children will look somewhat similar to adults in this sort of facet, everything I just mentioned, except for kids, it tends to be a little bit more rituals, like I have to count to 3 before I take the next step, and I have to put things in a very particular place. So it's ritualistic. It might be outside of them, external in their compulsions. Teens is when you start to see more mental compulsions, constantly obsessing, can't get off that track.
Interesting. So parents should really look out for those type of ritualistic things in their children.
Yes. Yeah. And again, just an underline, it's always good to just come in and see a therapist who specializes in this kind of work to get an assessment done. If it's not impacting, if you're seeing these behaviors, but it's not impacting functioning and distress levels, maybe, call a therapist to get some type of intake assessment done, but you don't need to run. If it's impacting distress and functioning levels, definitely look to getting in a specialized therapist.
Got it. And with children and teens, like I mentioned at the top of the show, it's kind of the onset happens in the teens, it sounds like, and sometimes as a child. Is it something where the sooner that they get assistance with it, it will mitigate that as an adult and not impact their life as adult? It's something if we catch early enough.
Yeah, absolutely. So our brains as kids and teens is so malleable. Our brains are still developing until we're there's some research that says that girls' brains develop a little bit earlier than boys. So we're done about like 23, 24. Boys are like more 25, 26. And this is, of course, very, ongoing research that's probably biased to some degree, but again, somewhere around the 23, 26 mark. So if you're catching it early, you're teaching these kids different skill sets, different tools, values that are going to follow them as their brain develops. And so it's going to become more useful to them as adults for sure.
Right. So it's probably like learning a language, different language as a child, then you've kind of instilled it into that malleable brain. So you're just to kind of be a habit as you get older.
Exactly. Yeah. And, I like to tell parents because, so often for them, the toughest part is seeing their child suffer and feeling like, why is this happening to them? And I'm not trying to silver line anything by saying this. I think it's just something to take into perspective. Although this is absolutely terrible that your child is dealing with a really tough moment here, they are learning skills that will serve them for decades on. And that in itself is really a worthwhile experience, as much as there is unfortunate suffering that's going on too.
Right. Yes. So important. Now you talk about intrusive thoughts and compulsions, and you've kind of mentioned some. Can you kind of give us, list out some examples of intrusive thoughts and then compulsions, just so we can really understand kind of the magnitude of what exactly those are? Because like we were talking about, a lot of us only think about, being neat and tidy. So
Yeah,
kind of what can those look like?
yes. Yeah. So any human brain, if you have a human brain that's turned on and working, you've had an intrusive thought. And I always just use this as an example. You're sitting in the kitchen or you're standing in the kitchen washing your dishes, you have a knife in your hand, and that weird little thought that comes out of nowhere that goes, what if I just I don't know, cut myself right now? Or I just threw this at my partner. Many people can relate to this. They're holding a baby. And all of a sudden what if I just dropped it out of nowhere? These are all intrusive thoughts and they are natural to the human brain. I like to consider them kind of like blips on the screen. And they're really meant to be temporary. They're not meant to be something that we spend too much time with. It's not uncommon that they're in relation to fear because our brain's job is to keep us safe. So it's often scanning for things like that. So someone with OCD, it can be just like those thoughts that I mentioned. Again, it tends to relate to their values because that's going to be attention grabbing. That's what's going to cause a person to feel like they're in threat if all of a sudden the intrusions they're having is about stuff that really kind of differs from who they are as a person. So like I mentioned, harm, sex, religion. There's a subtype often that is really people struggle with coming to get treatment for because there's a lot of shame called pedophilia OCD, which is this fear that I could harm children. I could be sexually harmful to children. Again, these people want nothing to do with that kind of behavior. And that's why these thoughts are so scary. And it can come in as what ifs. It can come in as this sense of oh, something's coming, I need to prepare. Compulsions, any kind of compulsive ritual loop type, either thinking or behavior. So behaviors are pretty easy to kind of visualize. This could be, I need to put something in a certain place because that's the only way it will be safe. It could be checking something a certain number of times. It could be doing a patterned routine. Mental rituals are a little bit harder at times for people to imagine, but think of it like this. You've been chewing on the same thought 86 million different ways for way too long. So I'm reviewing it. I'm thinking about what could happen. I'm imagining what could have been different. I'm shaming myself. It is this constant narrative that just drones on that doesn't allow you to be present in the world around you.
Right. So basically what you're saying is, in truth, we all can normally have intrusive thoughts, but when it kind of shifts into the OCD category is when they start affecting our lives or they become debilitating.
Exactly. Yeah. It goes from a blip on the screen to this feeling of, oh my gosh, because I had this thought, something really bad must be happening.
Got it. Understood. Now, there is actually this cycle of OCD that you've kind of alluded to as well. So what is kind of the cycle of OCD and how do the compulsions and avoidance actually make OCD worse?
Yeah, thank you so much for asking that because it's super counterintuitive what I'm going to say at first, but I think it's gonna make sense in a moment. So the cycle starts with what we would refer to as a trigger or sort of this stimulation of either a thought or something that reminds a person of an obsession. But essentially it starts that loop, that hamster wheel of, oh no, this is bad stuff. I can't handle this. So that misinterpretation of threat, that then turns on the fight or flight, which enables that compulsive type behavior. We humans, we don't want to just be in threat and do nothing about it. We got to do something to alleviate it and fix it. So that's where compulsions come in. And to your point, when we feed that cycle by way of compulsions, we keep it alive and well, because every time we do a compulsion, even though in that moment it's like, I just have to figure this out, or I just have to do this ritual, it feels like that's all you need. It's kind of like an addiction in some ways. It's like, it's never enough. It never satiates that need for safety or for certainty, because we're not actually just allowing it to be a thought. We're still misinterpreting that thought as a threat. So essentially, a person does these compulsions over and over. Maybe at first it only takes a few, but after a while, it's more and more and more.
So it's kind of reinforcing, or maybe even triggering like the award part of the brain, maybe possibly.
Got it. Yeah. So it's essentially like reinforcing that sense that this is truly a threat. I'm not capable of handling this. I have to do these rituals, or something really bad is going to happen, because I can't handle the uncertainty otherwise.
Wow. And that actually kind of perpetuates it, keeps it.
Yeah, keeps it, we call it keeping you sticky. Keeps you stuck and it keeps you sticky.
And then what is avoidance? How does avoidance come into play? And how does that pertain to this cycle?
So avoidance is what we would refer to as a maladaptive safety behavior. Maladaptive meaning it does not adapt well. It doesn't help you evolve. Intuitively, a person doesn't want to go near anything they think could cause these kinds of obsessive loops and these compulsions to happen. Unfortunately, although it's counterintuitive to remain with this stuff, to sit with the discomfort, that's exactly what we have to do. So in essence, when we avoid our triggers and we avoid what we're discomforted by, we increase and reinforce that sense of, I cannot handle this stuff. So avoidance really plays a pretty massive role for anyone who has OCD, but I would also suggest anyone who has general anxiety too. Avoidance is really, really common and perpetuates that.
Right, because it keeps you stuck in that loop, like you were saying. Now, how can OCD impair or negatively affect the lives of those with it? Like how does that how would that look in somebody's life?
So I like to think of OCD being like this little bully in a person's mind that pulls them into this little world inside their head. And that's essentially what they start living in more and more and more. So at first, it might be, oh, well, I just don't really want to go do certain things anymore because it could set that off. And then I'm not really going to go spend time with the people that I usually hang out with because that could set it off. And, oh, I don't think I can do this task anymore because that could set it off. The world keeps getting smaller because, like we talked about before, it can never be satiated. Avoidance and compulsions, it needs more and more and more. And so you might at first start going, I'll just eliminate a little of this. That's no big deal. A little bit more here, no big deal. And, in real time thinking of what this could look like, I often that I've worked with individuals who unfortunately they're isolated to their homes. They really are incapable of leaving. I'm going to rephrase that. At the time they believe they're incapable of leaving their home because they're so certain it's going to set off this doom that will come for them. Their OCD just has them in that belief. I would say, though, on the average, what it can cause in terms of functioning, a real disengagement from the things that typically bring people a whole lot of joy and a lot of shame, a lot of real internalized shame and frustration and guilt.
Oh, that shame and guilt's a tough one to manage and, even spot sometimes because it's such an intangible. And it sounds like OCD can actually be some sort of kind of a gateway anxiety type to other types of anxiety. Because if you're having these OCD, issues that could possibly lead to panic attacks. I mean, is it kind of perpetuating other types of anxieties if you don't sit there and find tools to mitigate it?
Absolutely, that's a really great way to phrase to look at it too. I think general anxiety, that's what when people say, oh, I have anxiety, they're often talking about generalized anxiety disorder, which essentially is relating to excessive worrying and struggling with that somatic sensation of anxiety. There's a lot of people who believe general anxiety and obsessive compulsive disorder are the same thing on a spectrum. One is more obsessive, one is more generalized. So, I would say that yes, absolutely. When OCD goes untreated, it can do in more of generalized anxiety. It can also cause for panic attacks, panic disorder, agoraphobia, which is when a person really doesn't want to leave their home at a certain point, increase other phobias, because it's all the fear center of the brain. We're talking about the same space. It's just a different lens that the fear is getting put through.
Wow. And you talk about how it triggers your fight or flight and your nervous system as well. And that does so much damage to the body and the immune system. And it's just kind of a domino effect. Now, we've talked a lot on the show. We just did a show on epigenetics. So, the nature versus nurture. What causes OCD? Is it strictly genetics, or is there more to it than that?
It's definitely one of those that has been, I think, pretty solidly and in a grounding way decided that it's a 50-50. It's both genetics and it's also what you are involved in. It's what you've been exposed to. So I'll give kind of a background of that. With genetics, it's really common for me when I'm working with a person, let's say an adult even, or a kid actually for that matter. Oh yeah, grandpa has a lot of this stuff you're describing here. And my aunt over here definitely does, or my mom and my dad do. Really, really common. Is it necessary? No. Have I worked with people who they cannot identify a single person in their family who has troubles with anxiety? Yes. I'd say more commonly, you'll see it in their family tree. And then also, you think about it as we're talking about that loop. What starts as this biological and this neurological misinterpretation then becomes habitual. Then we're building up habits to avoidance and choices and decisions. And that is that, in the nature versus nurture, that's the nurture talking. That's what you're exposed to. That's what you engage with. That's what maybe you saw your parents do. So we often see a 50-50 of it.
Interesting. Yeah. So it sounds like if the parents have it, it's something they can try to heal and mitigate before, they choose to procreate.
Absolutely.
Now, the exciting thing is there are therapies that work, and EPR is a therapy you work with that can help those with OCD. Can you explain to us what EPR is, how it works, how it helps those with OCD, and what types of results have you seen in your experience with your own clients?
Oh, yeah. So exposure response prevention, and then, or also known as exposure therapy really commonly, is a form of behavioral therapy. It's under the behavioral therapies umbrella. But unlike some others that people are very familiar with, CBT and DBT, where often you think about thoughts, feelings, and how those inform actions, we look at how can we make actionable change to now change how we inform our thoughts and feelings. A little bit of a flip reverse. And the reason we do this is OCD is historically known as the doubting disorder. So trying to reason with a doubt spiral is the never-ending story of no fun. It's going exactly. It's just going to keep it going.
Right.
So essentially what we do with therapy is we help a person identify what are the themes of their OCD, what's the stuff that their brain's getting sticky to. We help them create a hierarchy, sort of this ladder of what is the least amount of distressing to the most amount of distressing. And then we practice the art of exposing ourselves to these things, not avoiding, going towards the stuff that we don't think we're capable of dealing with, learning how to sit with it and not try to fix it. That's the big counterintuitive thing that really kind of makes people go, oh, Carly, what do you want me to do? I thought you were a therapist who was supposed to make me feel better. You're asking me to sit with my fear. But it's this really beautiful, profound process that allows a person to recognize not only am I capable, but I'm capable of more than I thought I was, because I can sit with fear. It's not great, but it moves when I don't get sticky in my thoughts. So it's a combo of learning how not to give full undivided attention to these looped thinking styles, acknowledging and accepting discomfort and moving through it, allowing the moment to be temporary. And it changes lives, just like very simply put. I mean, I've had individuals that I was working with for a year that at the start of the year, they were barely leaving their home, then moving across the country. And that time span can be shorter. It can be about the same. It can be in the middle. as a therapist, as someone who's worked in the mental health field for 10 years, I've never witnessed change happen as quickly as I do with ERP. And again, I think it's just because it really gets in and it intervenes and dismantles that system enough that a person feels confident.
Right. And it sounds a lot like self-mastery, where you're kind of like separating the mind from the emotions and really kind of mastering the emotions and mastering the mind and learning how to sit with them and, be the controller of instead of the being controlled by.
Yep, who's in the driver's seat. And I can't tell you how many times I've asked a client of mine, how are you feeling about this? And they start telling me thoughts, because that's what they associate with feelings. And so to your point, it's a lot of learning how to differentiate between the two.
Right. So important. And does it also, because you talk a lot about habits, does it also kind of help build positive habits like around this, so they're not, building the negative habits, kind of reversing that?
Oh yeah, it is. What I think most people come in expecting is, I'm going to learn how not to get so stuck on these certain thoughts or to be less afraid of these things, that then they get into it and like, I can do a lot with this. Like it's really not uncommon for me to see my clients decide, I'm going to go for that job I didn't think I could go for, or I'm going to go on this vacation I didn't think that I could do. So smaller habits in the midst of their day build to bigger and greater things for sure.
So empowering. Now, are there any other types? I know you work with a lot of different modalities. Are there any different types of therapies or modalities that you work with that you find help those with OCD?
Oh yeah. So I like to think of them as kind of like my toolbox. ERP is definitely the major medium that I use because it's the golden standard. However, mindfulness is really like it supplements and overlaps with ERP really beautifully. I'm a restorative yoga teacher, so this is very much in my wheelhouse of learning. I've learned and now teach others how to be with themselves, move through the moment without judgment. ACT, or ACT, acceptance commitment therapy, I like to think of it as ERP's very close cousin, because it's a whole lot about, I'm going to radically accept that this moment stinks, that I don't like this, and I'm going to keep on going regardless. So very similar. And then I use a lot of creative work. In my undergraduate career, I did a lot of expressive therapy and specialized in that. So I'm constantly engaging art and different other creative facets.
Beautiful. Yeah, I did a show several months ago on ACT. It's another powerful, it's very
Yep.
similar to self-mastery as well, and it's such a powerful modality. Now, for those experiencing OCD, what are steps they should take if they're not yet getting help? And for those who may not have the means to kind of hire or work with a specialist, are there any other practices they can implement and do on their own to help mitigate and minimize the effects they're experiencing?
Yes, there are resources out there. And it's one of the reasons why I wanted to start doing podcasts and start building on Instagram, is to help people feel like it's accessible and also feel like they're heard and they're understood. So first and foremost, if you are seeking out, whether it just be to get an assessment done because you're like, I think this could be it, or you need ERP therapy for OCD, first things first, you want to make sure they're specialized. So I work for a program where that's literally our specialty. So NOCD is a program that treats obsessive compulsive disorders and other compulsive disorders. That's our thing. So you want to look for something like that. If you're looking to on your local therapist database, make sure that they say they're specialized in ERP, and then call and ask them. Unfortunately, and it's just, I think more common than it is not. You'll go on Psychology Today and you'll see a list of therapists saying that they specialize in like 86 different modalities. And I'm here to tell you that would take a whole lot of work and a whole lot of years. So look and then call and ask. If you are not able to get an access to a treatment provider, there are workbooks, there are YouTube channels, there are Instagram channels, there are free community groups. There are resources out there. So some of my favorite workbooks, Kimberly Quinlan, she has both a podcast, the Anxiety Tool podcast, as well as a great self-compassion workbook. The International OCD Foundation has wonderful groups. NOCD, my program, also offers community groups, YouTube channels. Nathan Peterson is fabulous. He's OCD and Anxiety on YouTube. And then NOCD also has a YouTube channel. So there's work that can be done out there on your own. And still always give a call to those providers. See if they have a sliding scale. NOCD is always offering different accessibility rates.
And that's a really important point that you said, is really find somebody. Before the show, I never would have thought of, finding somebody that, you think of, oh, psychologists are psychologists, but somebody that actually specializes in specifically that sounds like it's absolutely vital.
Mm-hmm. I try to put it to people this way: when we are treating our physical health, we wouldn't go to a heart doctor for a bone problem, right? So, if we know that we have a very specific mental health need, look up to see, is there a specialized treatment protocol? Maybe there is, maybe there isn't. With OCD, there happens to be one. And then always double check, always give them a call and say, what's your background with working with individuals with OCD? Make sure it's not more of like, oh, I've treated one or two people before.
Right. Well, thank you for all those resources. I'll definitely post links to a lot of those below so people can find those resources. Now, we talked about, children and teens. Now, what if, a parent sees OCD tendencies in their children or teens? What steps should they take at that point?
Yeah. First, I would like parents to do their very best if they're starting to see signs and symptoms of OCD, anxiety, any kind of mental health disparity. Check in with yourself. How anxious are you right now? You love your kid. You want your kid to be okay. Your child can feel that anxiety. So I'm not saying to like repress that or to fake it or anything like that, but take a few moments to do some grounding yourself. And then do your very best to start asking questions. We parents and human beings, we're good observers, but I'm telling you, I have 5-year-old clients that I work with that can give you so much information. They'll feel more open to talk about it if it's talked about in a way where it's like, yeah, this is just a part of human chatter, talking about mental health. So for parents, start with checking with yourself. Don't go into conversations with your kids like that, pressured and anxious and worried. Do some deep breathing first, normalize it. From there, first thing I would say is that if you have no idea what you're looking at, talk with a pediatrician or try to find a child adolescent therapist in your area to start screening and asking questions about these things with, doing an intake. If you know what's going on, same deal. You want to find someone who's specialized in the treatment you need. And even more, you need to make sure they're specialized in children, adolescents.
Wow. Thank you so much for sharing those. It's so important, especially what you mentioned is really making sure the parents grounded first. I mean, it's so key to make sure we're not, traumatizing them more with trying to help them.
Exactly.
Now, I mentioned at the top of the show that only about 1/3 of those suffering with anxiety disorders actually receive treatment. Why do you think that is?
Yeah, this is something that as a therapist who treats anxiety and OCD, I'm like, I ponder on this a lot. I think everyone knows that there's a stigma around mental health. I can't deny that definitely doesn't have a part to play in it. But interestingly, I think the more that I've worked in this realm, I realize that so many people, rather than recognizing their suffering as suffering, they're frustrated with themselves. They're shameful. Why am I not just better? Why can't I just get over this? Why can't I just move on? I hear this so often. So I do think that a big proportion of it is stigma. And then I think another big piece of it is people don't actually know that what they're living through is truly anxiety and it's treatable and that there's options for it. And, on a bigger societal perspective, I think accessibility also plays another big part of it, education and accessibility, making sure that people have affordable options or they have insurance plans that provide affordable options. But those would be the big three that I would look at.
That's such a great point too. I mean, before the show, I didn't know much about OCD. So it's like really being educated to know, okay, what are the symptoms? How do I know if I had it? How do I know if I have anxiety? All these different things. Like you said, it could just be this frustration and shame and guilt in everyday life where you're struggling and you're not getting through it. But in fact, it's something that's treatable and beatable and mitigatable if you get help, but you maybe don't realize that you have a problem that is treatable and,
You got it. And it's, I joke around, but I'm serious. It's like, what if we taught this stuff in grade school? What if along with ABCs and 1, 2, 3s, we did mental health? Hey, this is what it's like to have a busy brain. That's anxiety. We'd normalize it. All of a sudden we have all these little kids growing up into adolescents who have language to be able to describe these things. And then adults who know, oh, I learned about this in preschool. I know what this is. that would be, if there's a dream I'd have for the world, it would be that we would just start normalizing that in education.
Absolutely. And then throw in the tools. And this is what you do if you're experiencing this or that. And then everybody's kind of growing up, learning them all and, getting it all into their habits already as children. That's definitely the dream. Now, if someone listening is experiencing OCD and wants to work with you, can you walk us through what the process looks like with what you do so we can kind of get an idea of what to expect and what kind of results have you seen with your clients with OCD kind of before and after working with you, and how does the work you do with them impact their daily lives?
Ooh, yes. So I work in the state of New York. I'm licensed in the state of New York. So I can only treat individuals who reside in New York. However, NOCD does treat everyone in the US, so all 50 states, but we also have therapists set up in Canada. We have therapists licensed in the UK and Australia, other countries as well. So the easiest way to check in to see if there's a therapist available for you is to go to treatmyocd.com. That's the NOCD website. There is a number there for our intake team, and it's a 15-minute free phone call to just do an initial screener. So if you happen to live in New York State and you're interested in working with me, definitely call, reference me. They'll get you set up, make sure that I offer your insurance plan. What does it look like working with me? I will say this is specific to me. I like to be silly. I like to add creativity. I'm my clients' teammates. You're not coming in and feeling like I'm the expert and you're the patient. I joke, but I'm serious. I'm useless without my clients because I need their feedback and their collaboration for the work to be profound for them. How does that impact them on a daily basis? I'd like to think, but I think I can objectively say too, we start small, but those small things build big moments. So what might look like just changing a little bit here and there to limit or eliminate some of their compulsions can pretty rapidly turn into lifestyle changes. Again, a very straightforward example is someone who doesn't leave their home or can't drive anymore is now out driving and going to coffee shops, or a person who didn't think they could travel, hadn't seen their family in 2 years because they didn't believe that they could get from point A to point B. They're able to do that now. Or even more internalized and simple, but really important. They're sitting in school and they feel like they can be there finally. They don't feel like they have to run away. So I do think that on the daily to the bigger basis, big changes happen.
Powerful. Bringing people back to the land of the living.
Yeah.
And loving life.
Yes, and they do it. I want to just make it clear. I think I'm a pretty decent therapist, but again, like they're the ones doing the work. I provide the skill set. If they weren't using it, those kinds of results wouldn't be happening. So for me, it's an honor to be on this ride with them.
Beautiful. And you mentioned that website for those that would like to contact you. Is that the website specifically to contact you?
Yeah, for therapy, that's the best. And then I also have my own Instagram where I try to provide a lot of education, some skill set use too. So that's Counseling with Carly on Instagram.
Wonderful. And do you have any other great resources on anxiety disorders and OCD that we can all check out between, I guess, your Instagram or Facebook or videos?
I definitely feel like, well, I joke around, YouTube is like a university at this point. Like, pick what you want to learn about. There's probably 65 channels and like billions of hours worth. But particular to OCD and anxiety, there's a lot of educational videos. And the one thing that I would suggest, I'll speak to this on kind of a bigger manner, despite what forum you use. There is a difference between a person's vlog versus an educational video, and just be aware of that. You should look at both because both are going to teach you and inspire you. But just make note of, am I watching only one person's personal view of what their experience was like? Probably should also go listen to this psychologist talking about this and this program talking about that too. So yeah, YouTube is great. NOCD has channels. Instagram, we have both the NOCD Instagram, my Instagram, several other therapists. There's quite a bit out there.
Beautiful. Thank you for sharing that. I'll post a link below to your contact, your Instagram, your website, and some other resources for everybody. Before we wrap it up today, do you have any final thoughts or words for those listening who are currently living with OCD?
Ooh, that this doesn't need to be the only thing you know. That OCD is a bully, but we can fight back. It will make your world small, but we can make it big again. And that recovery can actually look even more vivid and colorful than what you remember pre-OCD. It's possible, and it's being done every day.
Beautiful. Well, thank you so much for joining us today and sharing your knowledge on OCD, as well as all these amazing, helpful modalities and therapies and steps to take. I learned a lot, and I'm sure everybody listening did as well. So thank you so much for this really important conversation. And thank you so much for all the work you are doing.
Oh, thank you. Thank you for having me. I really enjoyed our conversation. Your questions were so helpful. And I hope this helps anyone who wants to learn more.
Remember, knowledge is power. The more you understand about your body, the better you're able to stay healthy and prevent disease. And a reminder, I am not your doctor, so please don't take this as medical advice. If you have specific questions about your healthcare, feel free to reach out to your practitioner. And if you like this video, please like it and share it with others. This information could really help someone you may know. And hit that subscribe button and the little bell to be sure you don't miss out on our future shows. And I will see you all next Wednesday on the next episode of Discovering True Health.